Dad, what's wrong with me? I'm really scared.
Honey, don't worry. We'll find out. You're losing so much weight. You're constantly going to the bathroom. We've come to see our family practitioner, and everything will be fine. We'll just see what she says, and we can go. We'll have lunch afterwards.
Come in.
Hi Gianna, hi Mr. De Niro. I'm Amanda, I'm the nurse practitioner.
Hello.
Hi.
So I've been reviewing your fasting blood glucose labs and A1C levels, and I just want to talk to you about them.
Okay.
Over the past few weeks, I've been monitoring your fasting blood glucose and your A1C levels. As you can see, the normal A1C level is under 6.5%. Yours was 8.2% after checking it twice, and your fasting blood glucose was 292. So with those values, along with your symptoms of thirst, excess urination, sweating, fatigue, I've come to the diagnosis of diabetes type 1.
What's that?
Diabetes type 1 is usually diagnosed in childhood or early adolescence. It comes up abruptly, but it's very manageable, and it could possibly be genetic. It's due to a lack of pancreatic beta cells that are supposed to secrete insulin. So since you have a lack of those cells, your body's not producing an adequate amount of insulin.
You know what, Gianna? My grandfather was diabetic, so that maybe explains you having diabetes type 1. Is there a cure?
There's no cure as of now, but it's very manageable. Diabetes is managed through insulin therapy and dietary control. The goal is to control your blood glucose levels since yours are always fluctuating.
Well, will I have to be on insulin for the rest of my life? What about soccer? Can I still play?
I will be prescribing Humalog insulin. It's a rapid-acting insulin, and you still will be able to play soccer.
Good.
You just have to remember to check your glucose before you're active and have a small snack with some carbs, about 15 grams of carbs before you're active.
Okay. So why do I need a snack?
The snack is to prevent hypoglycemia. I have some handouts for you to take home.
Oh, perfect.
Hypoglycemia is caused when your blood sugar falls below 70.
Okay.
And you'll present with signs like shakiness, fast heartbeat, sweating, fatigue, headache. You'll just feel naturally off.
I've experienced that before. So what happens if it goes too high?
Opposite is hyperglycemia, when your sugar falls above 250.
Okay.
You'll experience extreme thirst, you'll need to urinate often, you'll be very hungry.
Which you were kind of experiencing before, so
Yeah,
that makes sense.
So you could take this home with you.
Thank you.
And I'll have the diabetic educator come in to talk to you more about insulin and proper diabetic diet.
Thank you so much.
Thank
You're
you for all your
welcome.
help.
Come in.
Hi, how are you guys doing?
Hi.
My name is Mariah. I'm the diabetic educator. I'm here to answer any questions you may have about diabetes and the medication, okay?
Perfect.
Hi.
So, can you tell us more about Humalog and what does it do?
Okay, so insulin, it helps regulate your blood glucose.
Okay.
It helps it from going too high or too low, whatever your body needs. Since you have type 1 diabetes, you don't have insulin at all, so you need to take insulin. So Humalog, it starts 15 minutes right after injection, and it lasts for about 2 to 4 hours. So when you have a meal, you take it right before it.
Okay.
Okay. Any bad side effects?
Yeah, so Humalog can cause either hypoglycemia, meaning you will have, your blood sugar will go low. So what you want to do is have something with you at all times, a source of sugar, so your blood glucose doesn't drop.
Okay. What about the injection aspect of it? Can that cause any issues?
Okay.
Or?
So when you're giving the injections, you always want to make sure you give it at different locations in the body. So you want to give it subcutaneously, either in the arm, like the bottom fat, your stomach, abdomen, or like your butt area. So you don't want to do it in the same area, or else it's going to cause lipodystrophy, and that subcutaneous fat underneath, it'll kind of like disappear, and it causes like a dent in your skin.
Oh, okay.
That's good.
So you just want to be careful.
Okay, that's good to know. Anything, would the injection also irritate her skin?
It
does Humalog have any bad side effects?
Yes, so Humalog does have bad side effects. One side effect you can have is hypoglycemia.
Okay.
That's where the blood sugar will go below normal range and it can become very dangerous. So you want to make sure you have a carbohydrate, any type of like snack, sugar with you at all times. So if you do start feeling some symptoms of hypoglycemia, you want to take a snack and it'll bring it right up. Another side effect that can happen is hypokalemia. So that's when your potassium levels are low. So you want to take vitamins maybe on a regular basis to even prevent that from happening.
All right.
Okay. What about the injection aspect of it? Can that cause any issues?
Yes. Okay. So for injection, you don't want to inject yourself in the same area every time you give yourself a diabetic dose. You want to change up the spots because if you do it in the same area, the subcutaneous fat, it kind of like disappears. It's called lipodystrophy. So you want to change up the injection sites all the time. Okay. And something I want to mention is the sick day rule. So even if you're ever feeling sick, you still want to take your insulin. You don't want to skip it because just because you don't eat doesn't mean you don't need insulin. You always need insulin. So you want to make sure you're always maintaining your glucose levels, okay?
Okay.
That's good to know then. Is there would it irritate her skin perhaps, the injection, or?
So she might get like a little bit of redness or swelling at the sides.
Okay.
But if like you notice it like really like getting swollen, it can be an anaphylactic shock. People do get allergic reactions to insulin. So you want to call your provider or go to the hospital right away.
Are there going to be any changes to her diet?
So diet modification will definitely need to take place. It's made to ensure that your glucose is controlled throughout the day. You will need to monitor the meals and count the amount of carbohydrates you take and the sugars in your food. This is very important to maintain your blood glucose level.
Wait, so does that mean that I can't eat as much pasta and white bread as I usually do? Because I eat that with pretty much every meal. Like every meal.
Yes, I am aware that you like pasta and the bread and the pastries are staple in Italian cuisine. Since moderation of carbohydrate and extra sugar is key, let's create a plan, you know. There's some whole wheat pastas that you can have instead of regular pasta. It takes the carbohydrates right in half, you know. It's a good alternative. And you can measure it out using 1 cup to measure your pasta.
That's going to be tough, especially with Nana's cooking, especially on Sunday dinners. It's kind of like always a ritual for us, for our family.
That's another thing. You're going to have to work together with your family. Your whole family's going to have to work together in order for this to take place. You're all going to have to take part and cook together, you know.
Okay, well, thank you so much for your help and giving us specific details on what to do with her diet. We'll put that definitely to account for our family. And
yeah, you're welcome. No
thank
problem.
you very much.
Here's a list of food alternatives that you can like switch out, especially in the Italian cuisine. So you can take a look at this, and here are some recipes. Okay?
Thank you so
And if
much.
you ever need any more help, you can be free to contact me. I'll have the nurse come in to give you your first dose of insulin. Okay?
Thank you very much.
All right.
Thank you.
Have a good one. Take care
You
now.
too.
Okay? Bye.
Do you want me to hold it while? Thank you.
Come in.
Hi.
Hi.
Hello. My name's Brianna. I'm your nurse today. Can you tell me your name and date of birth?
I'm Gianna, and my birthday is April 27th, 2002.
Perfect. So I'm going to take your vitals first. Sure. So let me just... And Dad, can I just... sit in
Sure,
there?
of course.
Okay. Okay, so your vitals are stable. So, is it okay if I ask you for a few questions with your dad in the room?
Sure.
Okay. Do you drink any alcohol?
No,
You better not.
don't.
Okay.
Well, when you do, if you do, just remember before you drink, you have to cover yourself with insulin because that will shoot up your glucose level and can lead to a diabetic coma.
That won't happen anytime soon.
Oh, please.
All right.
It is also very important to contact your healthcare provider if you start any new medications, herbal supplements, vitamins, because that can affect your insulin requirement. Are you on any medications now?
No, I'm not.
Okay, good. Do you have any questions so far?
I just don't know how I'm going to remember how to do this insulin thing every single day.
Well, I'll go through it with you step by step together. And if you have any questions throughout it, just let me know. Are you ready?
I'm ready.
Okay.
Don't be nervous, Jana. We're all here for you, and I'll help you when you're home, and you do it as well.
Thank you.
Don't worry.
Since you are newly diagnosed, you will be checking your blood sugar more frequently, and over time, you will have a routine specific to you. If you need to especially check your blood sugar 15 minutes before you eat anything.
Okay.
Normal levels are 70 to 100, but again, since you're a new type 1 diabetic, your normal levels will be 80 to 180.
Okay.
So I'm gonna get the meter ready. So I'm going to wipe your finger with the alcohol swab just to make sure that it's clean, okay?
Okay.
So we're gonna let that dry. Once it's dry, we're going to prick your finger, okay?
Okay.
You ready?
Yes.
Good thing you're not afraid of needles. You'll be good.
Okay. So now you're gonna push out the blood, and that first drop, you're gonna wipe it away with a cotton ball.
Okay.
So now that second drop of blood, you're gonna put it right onto the strip, okay? Perfect. And now, as we wait, you can just hold that.
Okay. That wasn't too bad.
Yeah.
Pretty simple.
Okay, so your glucose level is 290.
That's high, isn't it?
Yes. So right now we're gonna be giving you 5 units of insulin to cover you for lunch, okay?
Okay.
So I'm gonna show you how to draw up the insulin. So first, let me get this all out of the way. We're gonna wipe the top of your insulin vial, okay?
Okay.
We're gonna let that dry. And we're gonna take the needle, and this is an insulin needle. Typically it has an orange top. We're gonna open that up. Now, since we're gonna give you 5 units, we're gonna draw up 5 units of air to inject into the vial.
Okay.
So you're gonna uncap it away from you, just so that you don't prick yourself too early. And you're going to inject the 5 units of air into the vial. Now you're going to invert the vial and draw up the 5 units. Okay.
Okay.
Now you're going to recap the needle. And then you're going to wipe the site that you're going to inject yourself with, okay?
Okay.
So if you can roll up your sleeve for me, I'm going to wipe the back of your arm.
Sure.
Okay, that's good. So you can relax. And you're just going to wipe in a circular motion, okay?
Okay.
So now what you're going to do is you're going to pinch the fat, and then you're going to inject in a 90-degree angle, okay? Are you ready?
I'm ready.
And then you're going to pull the safety so that you don't prick yourself again, okay? So
Okay.
all done, that was it.
Okay. That wasn't that bad.
Yeah.
Pretty simple.
Okay, so I'm going to have you do it now.
Okay.
To show me so that I know that you can do it.
I think I can handle it.
Okay, so let's get you set up. So first I would like you to show me how to test your glucose, okay? We'll
Okay.
just start from the beginning.
Okay. So first I'll put a new strip into the glucometer. Then I'll wipe my finger, the side of my finger, right?
Mm-hmm.
Okay. Then I'll prick my finger
Yeah,
and wipe away the first drop of blood, right?
yes,
Okay. And then I squeeze out the second drop of blood, and that's when I get the reading, correct?
yes.
So if it's too high only is when I take my insulin?
Yes.
Okay. So depending on how much insulin I need, I have to put that same amount of air into the vial, right?
Mm-hmm.
Okay. So before I needed 5 units of insulin, so if I needed the same 5 units, I'll drop 5 units of air. Is that right?
Perfect.
Okay. And then you said to clean off the vial, right?
Yes.
Okay. So
You have
I'll
to
clean
make
off
sure
the
it's
vial. Okay. So then I take out the needle again and I inject into the bottle
Mm-hmm.
in the air and I invert it and I drop 5 units of insulin. Good, like that?
Yep.
Okay. And then I would clean off the site of my skin, right? So then I clean the skin of the site, and that can be either the back of my arm, my belly, or my outer thigh?
Yep.
Okay. So then I pinch the fat, and I go in at an angle like this, and I inject it, like that.
Yep. And
And then I pull the safety on the needle, and then I throw it out.
perfect. Yep.
Okay, I think I can do that.
Okay.
Good job.
So I have papers for you just in case you forget or have any questions. But you can always access any questions, okay?
Thank you.
You're welcome. So it was nice meeting you, and again, if you have any questions, let us know.
Thank you so much.
Thank you very much.
You're welcome.
Hi, how's everything going?
Good.
Good.
You're just cleaning up?
Yep.
Remember to always put your insulin needles in a sharps container, never in the regular garbage can.
Perfect.
You could even use an old shoe box or an old plastic box you have at home just for all your syringes. So are you feeling confident to go home and give yourself your insulin?
I definitely feel a lot better.
I think she's ready.
Glad to hear it. Also, keep your insulin in a cool place like the fridge.
Perfect.
All right, you got your insulin. Enjoy your lunch.
Thank you.
You can finally eat.
Finally.
There you go.